Kristie Ennis, physical therapist, certified strength and conditioning specialist, and nutritionist. And today I am going to show you how you, on your own, can fix your carpal tunnel syndrome naturally. So that means no surgery, no medication, which is pretty darn cool. So the first thing to know about carpal tunnel syndrome, we all have a carpal tunnel, just know that too. But the first thing to know about the syndrome is that it comes from the median nerve, which actually starts up in the neck. So the median nerve comes out of the neck, travels down and down the front of the arm into the hand here. So when we talk about carpal tunnel syndrome, typically what people experience is numbness in this thumb, the index finger, and this third finger, and a little bit, this first half of this ring finger. You can get some weakness that happens in here. But one of the really key important things to know is that it doesn't just happen from here. Remember I said that nerve actually starts in the neck and branches off? So you can have that nerve pinched anywhere along this route that it runs and have symptoms. So one of the reasons that surgery doesn't always work is because people focus just in here and they're missing the rest of that nerve problem. So we're gonna actually start in the neck where it comes out. And if you can see, my muscles here happen to be pretty prominent, so it's actually pretty easy to see these scalene muscles. If they get tight, that's going to, again, cause those symptoms down below. So one way to work on that, there's actually a couple ways. If you take a Derma Edge and try to gently get into those muscles, now we're getting that fascia to start gliding a little bit better, the fluid to start moving a little bit better. To get in there a little bit deeper, you can take your fingers, pinch or press down. Careful not to really pinch too much, but pin that down, and then you're doing a little extension and turn. Ooh, and that should feel no numbness, no tingling, make sure of that. But you're gonna do that a few times after you do a little bit of soft tissue work in there to get that to release. And that usually actually feels pretty darn good. You're going to follow that up with what we call a mobilization or stretch into that first rib where those muscles are attaching. So I've got a handy dandy gown. You can dig a sheet or a towel right over the shoulder. You're going to pull down front and you're going to pull down in the back. I'm smushing my microphone. Pretend. And then you're going to add that stretch. Aim for about 30 seconds, 2 or 3 times. But it is important to add that towel part to it because then you're depressing, not the sad way, you're depressing though that first rib to keep those muscles relaxed. So that's the order for up in the neck there. Moving on down, a lot of times what I see is people are in this position on their computers, and so you can get a little entrapment right in through these pec muscles too. So even taking that Derma Edge and getting right in through those muscles, you can add a little bit of a pin and stretch here too. Press in and then open. Oh my gosh, that feels so good. I have issues here too, so I know these things feel good. And again, about 5 or 10 times for that. So little myofascial work first, a little deeper following that, and then follow it up with a stretch. Again, remember, no numbness or tingling here. So if you can, clasp those hands behind you, squeeze into those shoulder blades, and then lift on up. If that's too much, you can easily do arm, I'm going to scooch over this way. You can even do in the doorway or against a wall. This sometimes will be a little less numbness, but still get that stretch into there. And then very carefully throughout the day, little shoulder blade squeezes to keep this opened up. I usually make people do this every hour, about 5 to 10 repetitions every hour. That way you can't be in this position. Hopefully you don't actually type like this, but you get the idea there. Moving on down, sometimes again, that gets trapped, that nerve will get trapped in here. So this, and you can feel this kind of is a little bumpy. You can't feel it. I can feel that it's a little bit bumpy. You might even be able to see that. So now we're just trying where that nerve runs through here and through some of these ligaments to loosen that part up. From there, we're going to do what's called the median nerve glide. So arm's going to come out. I'm going to bend that wrist down and bring it up. You need to be very careful with this. You want to cause maybe a little discomfort, but not a lot. Notice I'm not holding it. I'm not stretching. We don't want to stretch the nerve. We want to try to glide that nerve. So if that's too much to start, you can bring that arm down and then add the wrist there. And again, just back and forth. If that feels okay, then you can go ahead and add a little head movement away. And And to follow that up, to make it even more, we're going to go right onto the wall and do that same idea. Now notice, some people will tell you to start stretching like this right away, but if that nerve's really irritated, you're just going to really kind of piss it off even more. So don't start here. This is an advancement. You can always start even just with a gentle wrist stretch this way too, if that feels okay. But remember, no numbness or tingling. That's why you want to start with that gentle motion. Now, all of that is to help loosen all those areas up. You also want to make sure that you're getting decent wrist motion, okay? So a lot of times I'll have people do a little thumb there, make a fist, and then add what we call ulnar and radial deviation. Again, make sure no pain, no numbness, no weakness, all of that good jazz, okay? Lastly, and this is something you actually probably want to start with, truthfully, this is a wrist brace from ATX that I really like. It works for both wrists, so you don't have to worry about getting a left or right. But a lot of times what happens at nighttime is that people kind of curl up like this, and that's going to just put compression through the area that you don't want to put compression on. So this is adjustable, and it's really pretty darn comfortable, so it helps keep that wrist in that neutral position, which means that you won't be doing this all night long. It's not machine washable, but you can actually wash it right just with soap and water in the sink, which is what I tend to do with it. And like I said, it's definitely one of the way more comfortable ones. So just for nighttime use, though not during the day. So that is kind of the series that you want to go through, and you actually should start noticing relief right away. That day even, which is pretty darn cool. Keep trying to do these exercises and motions 1 to 2 times a day, and you should be feeling way better. Thank you so much for tuning in today. Stay tuned for more. Check out my website at drkristieennis.com, and that's where you also can order one of your own